On summit! Woo!
Yes!
On Mount Everest, climbers are aiming for the top of the world. But it's not just cold and extreme height putting lives at risk. Many are pushing for the peak despite a coronavirus outbreak on the mountain.
Some of the teams were devastated by COVID. And once you lose your Sherpas, you can't climb.
Nepal's hospitals are overrun with thousands of new daily cases. Critical oxygen cylinders and vaccines are in short supply as Nepal's COVID storm continues to rage.
Nepal is in lockdown, battling its worst surge in COVID-19. The healthcare sector is totally overwhelmed. We'll talk to the Red Cross in a moment. First, the government's desperate calls for help from abroad, even the help of international tourists, a record number of whom have registered to climb the world's most famous mountain this year. The season's coming to an end, but the climbers could still do the people of Nepal a huge favour.
Gasping for precious breath in a race against time. These COVID patients in the Himalayas are fighting for their lives. But they're among a lucky few to have access to oxygen, a vital but increasingly scarce resource here. A recent surge in COVID-19 cases has brought Nepal's fragile healthcare system to a breaking point, and oxygen supplies are running out. Now the government's urging Mount Everest climbers for help.
In Everest expeditions, all climbers at the base camp have an ample number of oxygen cylinders. We have requested owners and operators to bring back those empty cylinders immediately after the completion of their expeditions, for the benefit of the people.
Nepal has issued some 700 climbing permits this season, a bid to get the mountaineering and tourism industries back on their feet. It's estimated climbers will abandon around 3,500 oxygen bottles on the mountain this year alone. Cylinders desperately needed in the fight against coronavirus.
Our government and city and our public, they have a lot of coronavirus sickness, so they have a problem for oxygen. I heard that. We have around 7 summit treks have around 1,000 bottles. So we can when the empty cylinder is come here, we can provide this cylinder to our government, and government will be make a refill for medical oxygen.
These bottles are being prepped for a mountain trek. If the government's plans work out, they could soon be saving lives on the ground.
Nitra Prasad Timsina joins us from Nepal Red Cross. He's in Kathmandu. Tell us about what's happening there, because you described the situation in India as a horrifying preview of Nepal's future. What is the situation like now?
Yes, the COVID cases in Nepal are increasing day by day. And then the rate of the infection is about 40 to 50%, in between 40 to 50% for the last 4 weeks. And then it has also reached to the rural areas. And then infection rate, now rural areas is increasing.
So COVID's spreading right throughout the country. What about hospitals? What about oxygen? How well equipped is the country?
The hospitals are overwhelmed. There is all the private hospitals and the government hospitals are full. There is no beds available, no ICU available, and then no ventilators available. People are dying without oxygen, without ventilator, and without ICU. And people are also dying without reaching to the hospitals. In rural areas, we don't have hospitals. And then many people are dying now in rural areas.
So Nepal's seeing exactly what happened in neighbouring India, but hasn't been able to equip itself in time. What about this? What about help from abroad, help from these climbers climbing Everest, bringing back their empty oxygen tanks? Is there enough help coming?
Yes. Many government for the last 3 weeks, many government and humanitarian organization has provided oxygen cylinder, oxygen plant, medical supplies, means all the masks, gloves, and then PPE, dead body bag, and many and medicines. So the embassies and then donor agencies and then the government from the developed countries and abroad, and also China has provided the now. And then the now situation is not that much acute, but still we lack the 60,000 oxygen cylinders.
What about vaccine? There's also been a call from government officials for help from abroad as far as vaccine doses go.
We don't have any vaccine right now, and then our government, our prime ministers and our presidents, they have approached to the government of Russia for the Sputnik vaccines, and then India, and then China, and then also UK Parliament, and also United States. And then China has promised the 1 million, but from others, no response. So India has given 1 million 3 months before, and then all the 1 million were administered to as the first doses, but we don't have the second doses. And then if the second dose will come, we are not sure. So the vaccine is a very serious issue. We want vaccines, and then vaccination is the only solution of the COVID.
So tell us, what does Nepal need to do right now to get on top of this situation?
We need the medical equipments and then medical materials to equip our hospitals, and also we need vaccines. We need two things: vaccines and then medical equipment, including oxygen cylinder and oxygen plant.
Okay, we'll have to leave it there. Thank you very much for joining us and being on the show today. Pleasure speaking to you. Netra Prasad Timsina there.
Thank you very much. Thank you,
Bye-bye.
DWTV. Thank you. Bye-bye.
Turning now to some other stories from the pandemic. India's coronavirus infections topped 28 million on Monday, with health authorities reporting over 2 million active cases. There is some good news. India's daily new infection rates continue to decline, indicating the current wave may have already peaked. China has locked down Guangzhou after a flare-up in new COVID cases. Initial reports indicate the new infections are linked to the mutation first detected in India. Health authorities are ramping up local testing and vaccination drives to prevent a widespread outbreak. The Palestinian territories have approved a single-dose version of Russia's Sputnik vaccine, dubbed Sputnik Light. Russia's direct investment fund is reportedly in talks with Indian manufacturers to start producing the jab as early as next month for use in Asian markets. And a record virus surge has hit Argentina, forcing officials to suspend the Copa America football tournament there. The chief cabinet minister said his country tried to keep its commitment to hosting the event, but the epidemiological situation made it impossible. South African President Cyril Ramaphosa says his country is reimposing a stricter lockdown amid a new surge in COVID-19 cases. He says Johannesburg and Pretoria are now in a third wave. The surge in cases also highlights South Africa's slow vaccine rollout. Only around 1.5% of the country's 60 million people have received a first dose. DW's Adrian Krish in Cape Town says another lockdown was inevitable.
The new restrictions don't come as a surprise to most South Africans because the numbers of new infections have been increasing in the past days and weeks and almost reached 5,000 new cases a day at the moment. This is still far away from the peak we have seen during the second wave in January, where we had more than 20,000 new cases a day, but it is still a reason to worry, especially because the vaccination campaign here has been starting very slow. South Africa has ordered vaccines for 75% of its population, but only a fraction of that arrived in the country. And the president here has been complaining about that many times before, saying it is not fair that wealthier nations have stronger access to vaccines than countries like South Africa and also neighboring countries on the continent here. So far, only those above the age of 60 are allowed to get the jab. So this is less than 2% of the population at the moment. Those who are younger than 60, even if they have comorbidities, don't even know if they'll be able to get a vaccine by the end of this year.
Time for Derek Williams and a question that could be on your mind if you're waiting for the jab.
I have a mild cold. Can I get vaccinated anyway?
Great question. You might have been waiting for months for an appointment to get vaccinated, and then the day before, your nose stops up. Well, I can tell you from personal experience with, for example, my kids' pediatricians, that in general, if you're feeling even a little under the weather on the day of a shot, then doctors really don't like to vaccinate you for anything. In the pandemic, however, the CDC, in the US at least, has apparently loosened that rule of thumb somewhat. And Germany's health authority, the Robert Koch Institute, it agrees. Both say that if you basically only have the sniffles, then vaccinators can go ahead and give you a COVID-19 vaccine. But if you're feeling moderately or more severely ill, they say, then you should wait until you recover from whatever you have to receive one. As far as I can tell, doctors and other medical experts appear to draw the line between mild and moderate illness largely based on the presence or the absence of fever. So if you just have a runny nose or a scratchy throat, but your temperature is normal or close to it, then you're apparently good to go. If you have a more acute sickness, however, that involves higher fever, for Germany's health authority, that's anything over 38.5 degrees Celsius, then you should wait to be vaccinated. But one way or the other, you need to be tested beforehand to rule out the possibility that you might have picked up SARS-CoV-2. And if it turns out that what's actually causing your cold-like symptoms is a mild case of COVID-19, then the recommendation is to wait until you've recovered fully, then at least another couple of weeks before rescheduling your appointment.
Derek Williams there. I'm Ben Fazulin. Thanks for watching. Stay safe and see you again soon.